Hello, good morning. My name is Grishmaben Patel. I am going to perform head to toe assessment today. Hello, good morning. My name is Grishmaben Patel. I am a student nurse from Seneca College. I have doctor prescription for your head to toe assessment. So, can you please tell me your name and date of birth?
My name is Kajal Chapaneri and date of birth is 22 August 1985.
And let me check your ID proof to match the hospital ID. So it matches your name and hospital ID match with the prescription notes. And thank you. Now I'm going to ask you some questions. And before that, I give you a privacy and wash my hand. And okay, can you please tell me your name and your mother name?
My name is Kajal Chapaneri. My mother name is Grishmaben Chapaneri.
And where are you right now?
I'm in 494 Runnymede Road, Toronto.
And what date is today?
Today is March 3rd, 2024.
So my client is oriented to the person, place and time. Now I am going to assess your eye. So your eyebrow is symmetrical. Now I am going to place the lights in your eye and you have to focus on my tip, okay? Tip of my nose. Now you have to focus on this pen and I am going to move the side by side. So my client pupil is equally round and reacted to the lights and accommodated. Now can you please raise your eyebrows and tightly close your eyes. I try to open it and wear your cheek like this. I'm going to push it together. So there is no any facial droop is noted. And I'm going to say one sentence to you and you have to repeat that sentence. Trees are greens.
Trees are green.
So my client is responded appropriately. So there is no slur speech is noted. Can you please stand up for me? Forward a little bit. Close your eyes and extended your legs. Try to stay still. Okay, so there is no any pronated drift is noted for my client. Sit down. Do you have any pain?
Yes, I have a headache.
Okay, when it started?
Started yesterday 10 p.m.
And how the pain feel like throbbing, aching?
Aching.
And how make it, which make it worse?
Bending down make it worse.
And what make it better?
When I drink water, it makes it better.
And in the numerical pain scales, if 0 is considered as no pain and 10 is considered as a severe pain, so how you rate your pain?
It's 2.
And is it pain is radiated somewhere any else, like
No.
in your arm and neck? Okay. So my client having a headache and the client is rating that pain on the numerical scale as 2 and it's not radiating at any other place and it started yesterday 10 p.m. When a client is drinking water, it's client feel better and then when client try to bend, it's the pain get worse and okay. Now I'm going to listen the your breathing pattern. So first, okay, now I'm going to listen your auscultate your breath sound anterior side. So I am going to place my diaphragm 2 centimeter above the clavicle at the midpoint of the right side and the same onto the left, same point onto the left side. Then second intercostal space at the mid clavicular line to listen the sound of the lungs at the upper lobes, then the same point onto the right side, then the fourth intercostal space at the mid clavicular line, same onto the left side, then the fifth intercostal space at mid clavicular line to listen the lower lobe lung sound, same onto the right side, then the sixth intercostal there is a sixth intercostal space at the mid axillary line, same onto the left side. Okay, can you please turn back for me? Now I am going to listen the posterior breath sound. So I start with the scapula here and I am following on the same point onto the left side and I am following the downward pattern to listen the posterior wall, posterior breath sound. Upper axillary, same on to the left side. The lower axillary, same on to the right side. Okay. I have assessed the, can you please sit down? I have assessed the breathing pattern of the my client. So there is non-laborious sound is noted, and I ausculted the anterior breath sound and as well as posterior breath sound. So there is no any adventitious breath sound is noted. There is no any crackles and no wheezing sound is noted for my client. Now I am going to listen your heart sound. So here is the clavicle, first intercostal space and second intercostal space. So I am going to place my diaphragm at the second intercostal space on the right side at the sternal border to hear the aortic sound. Then the same onto the left side at the left sternal border at the second intercostal space for the pulmonic sound. Then the third intercostal space at the sternal border for the ellipse point. Then for the tricuspid sound, I am going to place the fourth intercostal space on the left side at the sternal border, and the fifth intercostal space at mid-axillary line on the left sides. Here I am going to hear the apical pulse for the 30 seconds. So the apical pulse for my client is 68 beats per minute, and it's a regular rhythm and +2. Now can you please lie down on a bed? I am going to assess your abdomen. So first I am going to see the contour of the abdomen. So contour is rounded and there is no any distension is noted. And now I am going to assess the symmetry of the abdomen. So there is the abdomen is bilaterally symmetrical. Now I am going to inspect the abdomen. So there is no any lesions, no any bruise, no any discolorations of the skin, no any previous scar, and no any open wound is noted on the abdomen. Now I am going to auscultate the bowel sound, and I am going to use the bell of the stethoscope to auscultate the bowel sound. So first I am going to place the stethoscope bell of the stethoscope at the right lower quadrant, then right upper quadrant, then left upper quadrant, and the left lower quadrant. So during auscultation there is an active bowel sound is noted. Now I am going to palpate the abdomen. So during palpation there is no any lump and there is no any mass is noted. Okay, can you please sit down for me? Now I am going to assess your arm, upper extremity. So do you have any pain in your arm?
No.
Okay, now I am going to inspect your arm. So there is no any lesion, no any scar, skin is intact. There is no any sign of pressure or ulcer at the elbow and at the shoulder point. So and there is no any bruises is noted. And now I am going to see the capillary refill. So capillary refill is less than 20 seconds. Then I am going to assess the skin turgor. So there is no any skin tenting is noted. Now I am going to assess the muscle strength of your arm. So you have to resist my hand. Okay, this way, this way. Okay, so muscle strength is 5 out of 5. And now I am going to assess your lower extremity. So do you have a pain in your leg?
No.
Okay, now I am going to inspect. So during inspection there is no any lesions, no any scar, there is no any edema, there is no any sign of pressure ulcer at the knee, between the knee, at the toes and the heel, and there is no any discolorations of the skin, and there is no any bruises. Now I am going to assess the strength of your lower legs. So you have to resist my hand this way. Okay, so muscle strength of the leg is 5 out of 5. Now I am going to assess your pulse. So first carotid pulse, and then dorsalis pedalis, and posterior tibial. So my client pulse is rhythm is regular, and the pulse is bilaterally equal. Now I am going to document all the documents into my record book, and I am going to wash my hand. Thank you.